Good morning, everyone. Welcome to episode 19 of Tiny ADHD Superpower Knowledge. Today's topic is on ADHD and the negative stigma that surrounds it. Today, our medical understanding of ADHD comes from an abundance of studies that have helped identify the physical, mental, behavioral, and emotional challenges and characteristics of this disorder. Broadly, social awareness surrounding ADHD has somewhat improved, but not enough. So, why do we have a negative stigma against ADHD or other mental disorders in this case? The negative stigma related to ADHD can come from many places, including social and cultural expectations, as well as misrepresentation in the media or movies or TV shows. ADHD stigma involves negative stereotypes about the characteristics of a person with ADHD. These depictions of belief may be inaccurate, dramatized, or generalized, and often prevent people from understanding the many real different ways that ADHD people present. They may also go hand in hand with negative ideas about how to respond to someone with ADHD, such as being exclusionary or punitive, and therefore can impact a person emotionally, mentally, socially, materially, and physically. So there are four different types of ADHD stigma that we need to be aware of. First one is the public stigma or socially perceived stigma. This can happen when someone is being discriminated or biased in school, the workplace, or the clinic, or other examples of places in social gatherings. There's courtesy stigma, which are external sources of stigma directed at people associated with a person with ADHD, such as family members, friends, and caregivers. Number 3, internalized stigma or self-stigma. This is quite important. Internal sources of stigma that a person with ADHD direct towards themselves. For example, that will cause low self-esteem, isolation, not seeking others for help, not talking to your doctor, not seeking any mental support help, and that does not work, guys. Seek help. Last one, affiliated stigma. It's internal sources of stigma that family, friends, caregivers, and those with ADHD direct towards themselves. So the common misconceptions about ADHD, the most notoriously includes that it isn't a real disorder. It's a result of laziness or lack of discipline. It's a result of too much screen time, too much TV, too much games and stuff. That's not true. Research shows that there are differences between ADHD brains and those unaffected. These differences can show up in variation in cognitive skills, such as executive functioning, which I talked about in earlier episodes, reaction time, sustained attention, and more. A shift can look like treating ADHD holistically based on an individual's personal needs, as opposed to treating ADHD as a disorder requiring standard treatment across and among patients, instead of individualized services. The goal of ADHD treatment are to enhance a patient's strength, support their well-being, and help them cope with challenges by living with ADHD. And that looks different for every single patient. Medication can also cause stigma as well, such as what I'm taking. My mom and my parents, obviously, as a pharmacist, they never put me on medication when I was a kid. I did it myself when I went to the University of McGill, and it worked out perfect, and I'm still on it. It's been 25 years. But there are stigmas, definitely. Medication is over-administered. People with ADHD are over-medicated. Medication leads to other negative impacts. Medication is an easy way out for ADHD people. Medication is not a natural way to overcome ADHD. These type of discrimination can cause social challenges, difficulty in schools, workplace discrimination, and internalization of shame and denial. So guys, use your superpower. Don't give in. You guys are superhumans. Take care. That completes the whole 20 episodes of the Tiny ADHD Superpower Knowledge series brought to you by Healthcare Heart Inc. Thank you.